Good day and a warm welcome to everyone. I'm pleased to say that we can now officially commence today's event in celebration of International Day of Older Persons, entitled The Resilience and Contributions of Older Women in Asia and the Pacific. We're very grateful for your participation today. And before we begin with the opening session, we have a few important housekeeping remarks. To ensure the meeting runs smoothly and minimize any connectivity issues during the session, we kindly request for all participants to keep their cameras and microphones off. And please, throughout the meeting, feel free to make any comments via the chat box. During the Q&A sessions, permission will be granted to those who wish to speak once the floor is open. And we thank you very much for your cooperation. Now, without any further ado, I now have the privilege to start this session by giving the floor to Dr. Srinivas Tata, Director, Social Development Division, ESCAP, to deliver his opening remarks. Dr. Tata, the floor is now yours.
A very warm welcome to all who are attending our webinar today and on resilience and contributions of older women in commemoration of the International Day of Older Persons. Today, we celebrate older persons and their lives, achievements, and contributions to society. Although we define people aged 60 years and over as older persons, 60 years is not necessarily old, not in today's context. A woman who's 60 years old can expect to live for an additional 21.6 years, while a man can expect to live an additional 18.1 years as per our calculations. Women account for 54% of Asia and Pacific's population over 60 years, and that share, as you all know, increases with age. So in the higher income, in the higher age, as you go up into the higher age quintile, you'll find that the proportion of older women goes up. Thus, women should be at the center of all policies on aging. Let us celebrate and highlight older women's contributions to economies and societies. They are the backbone of the care system of many countries, providing unpaid care work, mainly to children, enabling younger women to pursue work. And they also provide long-term care to other older people and persons with disabilities. Not only that, they're active in older persons associations and contribute their wisdom and resources in dealing with emergency situations. And many older persons are today active entrepreneurs. However, their contributions are not accounted for systematically in the system of national accounts. Women have limited access to social protection, health services, land ownership, and income. So while older women live longer, the lives, again, are also not healthy. Women on an average spend 6 to 9 years of their lives with health conditions or disabilities. Ladies and gentlemen, on the flyer of this event, we have a photo of an 80-year-old woman who looks happy. Now, she is happy because she receives a monthly pension from the government. She has access to healthcare as part of the universal access healthcare coverage system that exists in a country. And she has a family in the form of a daughter who participates along with her in social activities. We know of her situation because she is the mother of one of our staff members. But we want that all women in Asia and the Pacific receive the same level of care and protection as she does to live happy and fulfilling lives. Today, we also launched the Asia Pacific Report on Population Aging 2022, which highlights the need to make contributions of older persons, particularly older women, more visible. It also highlights the need to provide universal and affordable access to social protection and healthcare as central part of all policies. Member states have also committed to a set of recommendations in the recently adopted outcome document as the 4th regional review of the Madrid International Plan of Action on Aging. Ladies and gentlemen, we have a very distinguished panel today who will give us deeper insights into the lives of older women in Asia and the Pacific, about their contributions and their struggles. And we will discuss what government, stakeholders, and international community are already doing and what can they do better and more to make older persons more resilient and fulfilled in contributing actively to societies all over the region. I thank you. Over to you, Mr. MC.
Thank you very much, Dr. Tata, for those inspiring words. It is now my honor to continue this opening session by introducing and passing the floor to Ms. Eva Ann Jean Sabdono, Yayasan Imong Lansia, Indonesia. Ms. Sabdono, the floor is now yours.
Excellencies, distinguished participants, good day. May good health, peace be with you all. First of all, allow me to express my deepest gratitude to ESCAP for the honor to present opening remarks at the commemoration of the International Day of Older Person 2022. With the theme, the resilience and contributions of older women in Asia and the Pacific. This theme is very close to my heart, as finally, the resilience and contributions of older women, which is seldom, if ever, recognized, finally get the attention of the UN and hopefully also by researchers and policymakers. Most research on family support networks in developing countries has focused on support provided by children to their elderly parents. Qualitative and quantitative field research in rural areas in Indonesia shows this assumption to be erroneous. Far from needing support, the majority of elderly people remain economically active and materially independent. The demand for assistance only arises if an elderly is ill, frail, or handicapped. How do older women contribute to society? The role of older women in providing material and practical support to their families is far from merely assisting with childcare and domestic tasks. In fact, they are often the central pillars of multi-generational families. Like any younger person, they work, they use services, and they pay taxes. They also volunteer. In fact, many social organizations would be hard-pressed to function without their older volunteers, who are mostly elder women. Older women babysit. They look after grandchildren. One can only imagine what would happen to our economy if suddenly no grandparents were available to look after grandchildren. How many parents would have to scramble to find other care options, which is already scarce, or would have to miss work because they couldn't find alternatives? Older women provide care for their spouse, children, as well as grandchildren when needed, with loving care 24 hours a day, seven days a week. She may not think of herself as a caregiver, but without her, who would get the groceries, run errands, and perform domestic tasks? Rather than creating catastrophic visions of the impact of the Great Tsunami, it would help if we took a more balanced approach to the aging population. One of the best tips we can implement today is to do away with barriers that prohibit older persons from being active participants in our daily lives. Older women are far from universally dependent. Indeed, oftentimes the source of support for dependents. As the strengths and weaknesses of current provisions for the older women are the best guide to the future, the sound knowledge of existing arrangement and their limitation is a necessary baseline for any examination of the issue. Is current support adequate? What gaps are there? How may a good level of support be defined? What capacity is there in current family and community arrangement to encompass a 3- or 4-fold increase in the elderly? What role can local and international organizations most effectively play? These and other searching questions need to be asked, and the need to delve into the workings of local support networks means that answer will depend on data that economic and social surveys alone cannot provide. Last but not least, let us encourage our seniors to continue playing active roles in our lives and society and improve the protections of the rights of older women as a fundamental right towards society for all. Thank you.
Thank you, Ms. Sabdono, for that insightful and important message. It is now my pleasure to proceed to the next session of today's event, the introductory presentations. And I'm now pleased to introduce Ms. Sabine Henning, Chief Sustainable Demographic Transition Section, the Social Development Division, who will present the situation of older women in Asia and the Pacific, latest evidence from the Asia Pacific Report on Population and Aging 2022. Ms. Henning, the floor is now yours.
Thank you very much, Hakeem. Dear colleagues, I'm just waiting for the PowerPoint to come on. Thank you very much. Very well. Good morning to everyone, ladies and gentlemen, colleagues. Thank you very much for attending today's event commemorating the United Nations International Day of Older Persons in Asia and the Pacific. The 2022 theme for this special day is the contribution and resilience of older persons in a changing world, and we're adapting it to the Asia Pacific region. As we all know, women contribute significantly to all aspects of society throughout their entire lives. In old age, they continue to support families through their work, both in the formal and informal sectors. They provide unpaid care for children, grandchildren, and older family members, and give shelter. In particular, during COVID-19, they were the backbone of families and communities across the region. Yet despite their many contributions, they remain largely invisible and disregarded, limited by gender disadvantages accumulated throughout the life course. This presentation will shine the light on the situation of older women in the region. Much out of what I will present today is based on the Asia Pacific Report on Population Aging 2022, which we're launching today. Next slide, please. Thank you. This report has been prepared in follow-up to the Asia Pacific Intergovernmental Meeting on the fourth review and appraisal of the Madrid Plan of Action convened at ESCAP in Bangkok from 29 June to 1 July. I would like to acknowledge the many contributors to the report, some of them joining our meeting today. It draws together documents prepared for the review and appraisal process, including voluntary national survey responses by ESCAP member states and summaries of consultations with civil society organizations. It also acknowledges the input from the report and the outcome document adopted at the intergovernmental meeting. It combines qualitative and quantitative analysis at national, sub-regional, and regional levels and considers good practices and lessons learned in national implementation while addressing emerging issues such as the COVID-19 pandemic, climate change, and digital transformations. The report is structured according to the priority areas of the Madrid Plan of Action and it includes chapters on levels and trends in population aging, data and research, and a chapter of conclusions and recommendations. Next slide, please. In the following slides, I will present a snapshot of the situation of older persons in Asia and the Pacific, primarily drawn from the first chapter of the report. It shows that over 60% of all older persons in the world reside in Asia Pacific, and this share is expected to increase to about 63 by 2050. In 2020, about 54% of all older persons in the region are women. Next slide, please. Due to the rapid declines in fertility and mortality, coupled with increased longevity, the number and share of the older population in the region increased sixfold from 1950 to 2022. By 2050, that number is projected to double to reach 1.3 billion. Thus, 1 in 4 people in the region will be 60 years or older. Put another way, 1 in 7 people in the world will be an older person from Asia and the Pacific. Next slide, please. No, please stay on this slide. Okay, thank you. The population in Asia and the Pacific is aging faster than in any other world region. Due to the drastic declines in mortality and fertility, the countries now aging are taking much less time to increase the share of their older population from 7 to 14%, or to transition from an aging to an aged society. In many European countries or Northern America, this process took half a century or more. Next slide, please. Given women's longer life expectancy, the share of women compared to men increases with age across the region, as you can see in the dark red patterns, showing the age distribution and by sex for the sub-regions of Asia Pacific by different age groups. Women, especially those in developing countries, enter old age with the accumulation of a lifetime of gender-based disadvantages due to fewer opportunities for education, lower likelihood of being covered by social protection, and limited access to health services, land ownership, and income. In old age, they frequently continue to perform unpaid care work in the home and often must work to maintain their own livelihoods. Next slide, please. Interestingly, through the member state surveys, countries identified health, promoting and well-being throughout life, mental health issues related to older persons, issues related to older persons with disabilities, lifelong learning, abuse and neglect, and housing as some of the priority areas for taking further policy action. In the next few slides, I will discuss these in more detail with a view to the situation of older women. Next slide, please. In 2022, women in Asia and the Pacific are estimated to live 7.7 years compared to 70.5 years for men. However, in comparing life expectancy at age 60 with healthy life expectancy at age 60, one can see that women on average spend about 5 years on ill health. So if you compare the dark red pattern with the shaded red pattern, you see a difference. This difference refers to those 5 years on average that women will most likely spend in ill health, older women. Importantly, when discussing aging and health, it is important to also recognize the linkages between the physical and mental health of people and the effects of social economic factors on health and the impact of health on the overall social and economic situation of older persons. And closely related, ageism and age discrimination are important factors that have an impact on older persons, often particularly women. There's not much data on this, but from the studies we have seen, we know that it is on the rise in the region. Thus, aging and healthy aging have a gender dimension that needs to be addressed when formulating policies or programs on older persons. Next slide, please. In a few countries in the region, life expectancy of women at age 60 has increased significantly, as the following slide shows. For these 10 countries, for example, women at a minimum can expect to live an additional 27 years, which is very impressive. Next slide, please. Despite these positive developments, not all older persons, and older women in particular, can spend their longer lives enjoying the fruits of their labor. As the following graph shows, many older persons must continue to work in order to maintain their livelihoods. In many countries of the region, they only find work in the informal sector, and and older women compared to older men are even more likely to work without social protection, lower wages, and under hazardous working conditions. Next slide, please. Closely related, the coverage of contributory pensions in many countries is very low. This is connected to the high incidence of informal employment, which I've just shown, which has left workers, particularly women, vulnerable to income insecurity and old age poverty. In the member state surveys and stakeholder consultations held in preparation for the fourth review and appraisal, participants noted that many countries have implemented social pensions. Although these pensions are very helpful, their levels are often insufficient to cover daily expenses. Next slide, please. Although older persons in Asia and the Pacific in general live with their families, older women are more likely than older men to live alone. The Madrid Plan of Action encourages governments to promote aging in place. This stresses the need for independence and self-sufficiency of older persons. Furthermore, the aging in place concept requires age and disability-friendly housing designs and public infrastructure, as well as affordable accommodation and transport. Through the surveys, member states reported on some good practices, many including efforts to improve mobility for older persons and the use of universal design features. However, these examples are not the rule. Next slide, please. In summary, women constitute the majority of older persons in the region. Their numbers and shares will continue to grow. Their socioeconomic situation differs in many ways from the situation of older men. At the intergovernmental meeting, member states agreed to mainstream gender and disability perspectives into policies promoting societies for all ages. And this is part of the outcome document that was adopted at the intergovernmental meeting. Let us continue to work towards a sustainable society for all and for all of all abilities in the future. I invite you to therefore review the report on aging, which we're launching today. And this report might help you and help us to contribute to creating the society for all of all ages in the future. Just in follow-up to the intergovernmental meeting, ESCAP continues, if I may ask for the next slide, please. ESCAP continues to support member states in assessing the situation of their older population and to developing and drafting policies on population aging. Apart from the report, which we're launching today, we have also a website dedicated to population aging that showcases, for example, our data sheet. The one from 2021 showed data on older persons. We also are putting together a repository of policies on aging. We have a specific dashboard on data on policies and also the situation of older persons. And we will soon add e-learning. And we very much invite you to review this website when you work on this very important issue. With that, I thank you for your attention and I give the floor back to our MC. Thank you.
Thank you very much, Ms. Henning, for that comprehensive overview. I'm now pleased to introduce Ms. Vanessa Steinmeier, Population Affairs Officer, Sustainable Demographic Transition Section of the Social Development Division, ESCAP, who will be sharing with us a video presentation. Ms. Steinmeier, the floor is now yours.
Thank you, Mr. MC. Distinguished participants, ladies and gentlemen. We already heard of the many contributions that older women make. And we also heard that these contributions remain largely invisible. The main reason why these contributions remain invisible is because women are not paid for these services and they are taken for granted. We have to repeat, these services are provided for free. And what is provided for free is unfortunately not calculated in the system of national accounts and does not flow into GDP. However, let's think how much each of us would have to spend if we had to pay the price of a restaurant meal for every home-cooked meal. What would happen if the grandmother would charge the salary of a tutor every time she takes care of her grandchildren? If we calculated this, the contribution of care to GDP would be enormous. Ongoing research projects, which are supported by the United Nations, seek to make these contributions visible. Part of this research is the calculation of national time transfer accounts, which counts the time women and men of different age groups spend for market work and how much they pay for unpaid care work, and to which age groups this care work is given. ESCAP commissioned such research on several countries in the Asia-Pacific region, which is published in a working paper on the website of ESCAP. The video we are playing now highlights the finding of this research and quantifies the contributions in terms of time of older women. Thank you, and please enjoy the video.
The older population in the Asia-Pacific region is growing more rapidly than in any other part of the world and is expected to represent 1/4 of the region's population in 2050. The percentage of the population aged 80 years or over is rising even more rapidly, and there are more older women than men in the region. This film is based on the study Older Women and Men as Recipients of Care and Caregivers, conducted by the United Nations Economic and Social Commission for Asia and the Pacific, in which time-use surveys were used to examine patterns of unpaid care work in selected countries in the region. So, what is unpaid care work? Unpaid care work refers to direct care provided to children, adults, or the general community, as well as indirect care, which refers to housework. Unpaid care work sustains societies, maintains well-being, enables others to perform paid work, and helps families to raise children and support older persons. Although both women and men are engaged in unpaid care and market work, women of all ages perform the majority of all types of unpaid care work. Children are by far the recipients of the most unpaid care work in all countries, and women are the main care providers. Older persons are often perceived as needing care, but the analysis of the data in the study shows that older persons, especially women, including those aged 85 years or over, spend considerably more hours providing unpaid care than they receive from others. Most of the unpaid care work they provide benefits other older persons, including their spouses. But older women also provide a significant amount of unpaid care work to younger family and community members, while men in that age group contribute considerably less. In spite of the important care work women provide, they receive little compensation and recognition for it and have limited access to social protection. Leaving out unpaid care work makes such work invisible. This is an even greater blind spot when viewing the working lives of older persons relative to people in the peak stages of paid work. People never stop performing unpaid care work, not even in the oldest age groups. If unpaid care work remains invisible, we disregard much of the contribution of older persons to economies and societies. Given current and future levels and trends in population aging in Asia and the Pacific, society must pay more attention to people in the care economy and to support those who need and provide care. With rising care needs among older persons, relying on unpaid care alone will be insufficient. Target 5.4 of the 2030 Agenda for Sustainable Development calls to recognize and value unpaid care and domestic work through the provision of public services, infrastructure and social protection policies, and the promotion of shared responsibility within the household and the family as nationally appropriate. The Madrid International Plan of Action on Aging recognizes the role of older women as caregivers. It recommends to develop and implement policies aimed at ensuring that all persons have adequate economic and social protection during old age, and strive to ensure gender equality in social protection, social security systems. To achieve the respective goals of the 2030 Agenda, we need to make unpaid care work visible and provide financial and social support to unpaid caregivers, in particular women. Policies should recognize older persons as a resource and invest in their health and well-being. Affordable quality care for children and older persons is crucial to reduce the demand for unpaid care work and the burden largely borne by women. At the same time, it is important to ensure a more family-friendly work culture and encourage men to provide more unpaid care work throughout their lives. We must take care of those who care for others.
Thank you. I hope you enjoyed the video. And I would now like to hand over to Hakim, our MC. Thank you.
Thank you, Ms. Steinmeier, for that informative presentation. And that now concludes this session of introductory presentations. And before we proceed to the next session, we kindly request for all participants to turn on their cameras now for a group photo. So it should be possible now for all participants to turn on their cameras for a group photo.
Look at your camera and smile. 1, 2, 3. Okay. Can we have more shot? 1, 2, 3. Okay. I think right. Okay, we good. Thank you. Go back to you, Hakim.
Thank you very much, Ms. Supatra. Okay, so yes, we now request for participants to turn the cameras off, but it was great to see everyone's faces. Okay, with that said and that complete, we can now commence the panel discussion, and it is my honor to give the floor once again to Dr. Tata, who will be serving as today's moderator for the panel discussion. Dr. Tata, the floor is yours.
Thank you very much. Thank you very much, Hakim. And I suppose we are ready to start the panel discussion. All cameras off, except for those of the panelists. As I mentioned in my opening remarks, we have indeed a very distinguished panel here to answer, to provide insights and identify priorities and to provide their thoughts and ideas on how we can really acknowledge and the contributions of older women and how we can build the resilience of older women in our rapidly aging societies. We have a panel, we have a 5-member panel, and I'll introduce them as we go to them. I can just briefly mention right now and then provide a more detailed introduction as I start the panel discussion and I go to each one of them. Our panel members, in the order in which I'm going to go to them, are Dr. Juan Perez III, the Undersecretary for Population and Development, and the previous Executive Director of the Commission of Population and Development in the Philippines. Professor Geeta Sen, the Distinguished Professor of the Public Health Foundation of India. Ms. Anisa Ahmed, who is the co-founder of Hope for Women in Maldives, who has also been a parliamentarian for a long time. Dr. Kanwaljit Soin, who recently retired, who was practicing orthopedic surgeon in Singapore and is also the president of the Women's Initiative for Aging Successfully in Singapore. And Dr. Tengku Aizan Hamid, who is a professor of gerontology and also a research fellow at the Malaysian Research Institute on Aging at the University Putra, Malaysia in Malaysia. Now, without much ado, I would like to start our panel discussion with my first question addressed to Dr. JP, as we more popularly know him, Dr. Juan Perez, who is the Undersecretary for Population and Development and the Executive Director of the Commission on Population and Development in Philippines. He's a medical doctor and a public servant. He's had more than 40 years of experience in public and private sector health programs in the Philippines. He headed the Commission on Population and Development, POPCOM, as its Executive Director from September 2013 to September 2022. That's 9 long years. He has managed substantial programs with the Philippines Department of Health, the United States Agency for International Development, the World Bank, and the Asian Development Bank. So he's really extremely, we are very fortunate to have him as part of our panel. And my question to him, Dr. Perez, population aging is very rapid in Asia Pacific. In Philippines, the share of women 60 years and over is projected to almost double from 9% in 2022 to 17% in 2050. What are the health, social, and economic implications of this? And what is the situation of older women right now in your country? So over to you, Dr. Perez, for your response.
Thank you, Srinivas, and thank you to ESCAP for having this webinar on the International Day of Older Persons. First off, the age group over 60 years old in the Philippines is the one group that is growing fastest at 3.5%. And while the population is growing, the general population is growing below 2%, around 1.7%. The older persons have the highest growth rate. And women constitute 55% of the older persons, around 8.5 million currently in the Philippines. Now, their health situation is not equal to the positivity of their numbers. No? We are fortunate to have been able to have 2 points of analysis. In 2007, we had a study on the elderly, and in 2018, we started a longitudinal study on active and healthy aging in the country. And when we look at those 2 points, no, in a span of 11 years, we noted that the number of the percentage of men who were active, could be active, was 77% in 2007, but this has gone down to 70% in 2018. But the situation of Filipino older women is much worse. No, in 2007, 68% of them were leading active lives, but this has gone down to 56% in 2018. So this is an indicator of functional health in the country, and their decline is showing that there is greater morbidity across the board for older persons, but more so for women. And we also saw that, and we thank the UP Population Institute, Professor Grace Cruz, for these findings. No? When it comes to the, let's say, economic, the social situation of women, older persons in the country, there is no gender difference among men and women when it comes to education, although we are seeing that the younger group among the older persons tend to be more highly educated. However, the norm is rather low at an elementary level of education for older persons. We also, we see a major gender difference when it comes to marital status, as we are seeing more women who are living alone and are widowed, no? At 56% are widowed versus around 60% for men who continue to live with their spouses and or live in, no? So the situation is rather different when it comes to marital status. When it comes to living arrangements, the norm today is co-residence with children. No, That is what most Filipino men and women are experiencing. Now, economically, the numbers are also not good. As of the 2018, those who were still active economically were around 57% of the population, were around more than 50% of the population, but 57% said they had difficulty in meeting household expenses. So they may be working, but they are not able to meet their daily expenses. And this is so we are seeing a situation where we have older persons increasing in number, but in that number, you have more morbidity and you have more poverty. And we saw with the COVID situation that there were greater number of deaths among older persons, 86%. So the situation for older persons in the country remains difficult. And this is something that we need to work on very quickly.
Thank you very much, Dr. JP. You really set the stage, and allows me to come back during the second round, I think, to allow you to elaborate a little bit on what the government of Philippines is planning to do about it and already starting to do about it. So I think what you described might be true for a number of countries in our region. So it was great to get your perspective. And as you know, we have 2 rounds of questions. And so we'll be covering all the panelists for 3 to 4 minutes in the first round, and the coming round is second. So we'll be back to Dr. JP after we've covered all the panelists in the first round. And our second panelist here is Professor Geeta Sen, who needs no introduction. She's had more than 40 years of experience working nationally and internationally on gender equality and women's human rights. Her work has ranged from poverty, population policies, human development, labor markets, and women's health. As I said before, she's currently the distinguished professor and senior advisor at the Center of Equity and Social Determinants of Health at the Public Health Foundation of India. She's known for sharp analysis and strategic advocacy. And she's the founder and currently general coordinator of DAWN, which is Development Alternatives with Women for a New Era. So my question to you, Dr. Sen, as we have heard, women account for the majority of older persons in Asia and the Pacific. Many of them remain active in their communities into old age, and yet they are victims of inequality. They live in isolation, cannot afford to regularly see a doctor, or struggle, as Dr. JP said, to make ends meet. How do you see, the situation of older women in Asia Pacific from your perspective? Over to you, Dr. Sen.
Thanks very much, Srinivas. And let me start out first by saying what a pleasure it is to be back with an ESCAP group, even though it is virtually. I would much rather have been in Bangkok.
Yes, we would have loved to have you here, yes.
So let me try and first preface my answer with something that I think is really important as we consider the problem of aging. And that is, as we know, as societies age, and all our societies are aging, and as the numbers and proportions of the older population grows, there are policy concerns about the clash between rising dependency ratios on the one side and calls for fiscal discipline on the other side. And the fiscal discipline calls we're all familiar with. They are inbuilt in our systems now. They're part of the neoliberal globalized economy and its transformations. But what this tension often means is to look for where is it that the fiscal budgets can be cut, can be reduced. So this, of course, has fueled interest in what is called active aging, productive aging, aging in place, etc., which on the one side has very positive connotations of people being better able to take care of themselves, families taking better care of older people making greater contributions. But on the other side, one can't help having a bit of a cynical concern that it feeds very nicely into a fiscal discipline paradigm, which means that the state's responsibilities can be reduced. One of the distinctions that's been made in the aging literature is also this distinction between what is sometimes called the third age, which is the active age, and the fourth or the dependent age. And policy attention has been directed at delaying the onset of that fourth dependent age as long as possible and keeping older people active for as long as possible in the third age. Now, as I said, there's pluses to this, but there's also some questions that one has to raise about what does this mean in terms of government budgets and so on. Now, my question here is whether this kind of policy debate can ignore the implications of inequality. For example, early and sustained health insults to those at the lower ends of social and economic inequality tend to accumulate. And sometimes they alter the concept of old age itself. When does it start? What are its boundaries? As well as the health consequences and needs in later years. An example based on my own and my team's work on the ground, field work in poorer areas of the state that I live in, is how poor people refer to old age and at what age they think someone is old. And in some communities, 45 is considered old age. Now, why is this? And let me ask Hakeem if you can just show that photo. There you go. So there's a woman. This is a real photograph from our work. Obviously very productive. She's working on something there. And just look at her. And how old do you think she might be? One can't tell. She could well be 50 years old. A bit less, maybe, a bit more, maybe. But that's what I mean by, thanks very much, Hakeem. That's what I mean by not knowing when we ignore the implications of inequality and what it means that even what is considered to be old age can vary depending on which end of the socioeconomic spectrum one may be. So early and sustained health insults. For example, let me give an example about gender differences. In the India WHO SAGE study, found significant gender differences of the kind that our PowerPoint and presentations have identified. But just quickly, 73% of women, in this case over 50, and that may be appropriate given the photograph I just showed you, in the sample had no formal education versus 31% of men. Female-headed households were, of course, much poorer. 59% of older men were self-employed versus only around 20% of older women. 75% of women, older women, reported moderate or bad health status versus 64% of men. And as many as 83% of women said they had some or severe difficulty performing work or household activities versus almost 20 percentage points less for men. So the accumulation of a lifetime of gender insults, unequal economic resources, whether they are assets and income, disproportionate burdens of unpaid care work that we've seen already, lower education and higher illiteracy, higher burdens of untreated or poorly treated illness, few resources with which women enter the third and especially fourth ages. And then, of course, there are the intersectional challenges. if, for example, an older woman is living with disability or becomes disabled, as often happens. On the other hand, women live longer, are more likely to be widowed, and dependent on children for economic support and care in the fourth age. These challenges have been heightened by COVID-19, when fiscal budgets and health systems became severely strained. And what they've led to in a number of situations is pressure to delay or cut back on old age pensions, health or other services seen to go to groups that are seen as being somehow less productive. And I think it's very clear that we need to take account of what these inequalities against the challenges of fiscal discipline versus the needs of older people and older women, what they might mean. Thanks very much.
Dr. Sen, you really gave a very comprehensive reply, and you also kind of brought up interlinkages. You also brought up the whole issue of the role of state versus, we are highly now looking towards the role of the individual and the family taking care, and where's the balance. I think this was a very important point, and you highlighted the differences. I mean, the many determinants of inequalities, and that are faced by older women. And I will definitely come back in the second round to really ask you about some of the ways in which we can address these inequalities. But thank you very much for laying the table for us so well. And it allows me now to go on to our third panelist, Ms. Anisa Ahmed, who is a co-founder of Hope for Women in Maldives. She's another doyen in this area, having worked 34 years in public service, including 12 years as a member of parliament. You started a career as a nurse, nursing being a choice of profession, but moved into foreign services. You worked in many areas in the executive level and held ministerial positions. And Ms. Ahmed is also the recipient of the United States of America Secretary of State's International Woman of Courage Award in 2012. So very delighted to have you on our panel, Ms. Ahmed. And for you, my question is, Maldives is an example which is going through rapid population aging, and drawing upon your rights, your experience as a women's rights activist. What are the most pressing issues in Maldives and elsewhere that need to be addressed so that older women can age in dignity and have full respect for their rights? So over to you, Ms. Ahmed.
Thank you, Dr. Srinivasan. I have a problem with my throat today, so my voice might break now. Please excuse me for that. I just, begin with, highlighting on the data about aging in the Maldives. Like everywhere else in the Maldives too, life expectancy has risen from 45 years to 79.6 years within a period of 50 years. Today, we have 78.6 years for men as life expectancy and 80.8 for women. In the Maldives, older person is considered somebody who is 65 and above. Our older age population constitutes 5% of the total population, and it's our women comprise only 48% of the total population, while men comprise the rest. But women dominate the 75 plus age group. Our society is dominated by the clamor of the youth now. And elderly people have become grossly undermined, and old age is viewed as a great disadvantage. Now, coming to the question put to me. To my knowledge, there has not been any study done on the changes in the society resulting from aging population. Besides, I also would like to say there is not a single geriatrician in our country still. In my work, I have observed that older women face specific challenges that inhibit a happy and fulfilling life for them. First of all, the family, especially the grown-up children, perceivably become overprotective and prevent or discourage their mothers from gainful employment or doing any productive work. As a result, women become heavily dependent on their children and they become isolated from the society and their peers. I'd like to add here, however, that this protectiveness does not apply when it comes to trusting their young children with their older parents. Sorry again. What I mean to say is the burden of caring for their young children and doing most of the household chores while they are at work away from home. So the overprotectiveness comes only when it comes to women's mobility and freedom. The other category of women who become marginalized and isolated, even in their own homes, due to the digital divide between generations in the country. Young members in the family do not have the time to interact or spend time with their elderly parents or grandparents. While older people do not have the means to even access news media, even when our women are our literacy rate for women is very high because most of our news is online. As a result, many such women go into chronic depression. They need constant medical attention. Some of them become even unable to take care of themselves at that stage. So they become dependent otherwise also. Another problem we have among elderly women is violence against women, especially adult women or elderly women. According to data available, this happens mostly within homes, especially by young substance abusers in the family and expatriate caregivers. In the Maldives, we have a number of elderly people being taken care of by expatriate workers. Osteoporosis and arthritis are very common also. These are medical conditions that debilitate women. Hip and knee replacement surgeries are done free, but the aftercare becomes a problem. So they become debilitated and not able to look after themselves. Besides this, the near absence of facilities for any recreational activity and lack of means to stimulate their intellect also have very negative impacts on aging, particularly among women. There are no community centers, no libraries, no cinemas within access for them to relax and enjoy, or even socialize with their peers. So these are very great constraints that we have, besides the other problems that are actually considered problems for both men and women, elderly men and women, like safety on the roads. Not only on the roads, but safety otherwise too. So am I to stop at this time? Dr. Srinivasan,
it'll be great. I'll come down to the second. We can cover, but I think you have 30 seconds to kind of just round it off, ma'am. Any other important points?
Yeah, what I was going to say is, although this is not specific to women, elderly women, we
in Singapore, you've been an advocate for healthy aging over the life course. What particular health challenges do older women face, and What are the good practices from Singapore in addressing these challenges? Dr. Soin, the floor is yours.
Thank you. Okay, sorry for that. I forgot to unmute myself. I would like to thank ESCAP for this invitation. Singapore has one of the fastest aging populations in the world, and also with one of the longest life expectancies. The life expectancy of women is about 86 years, and they outlive their male counterparts by 5 years. For those who are over 80 years of age in Singapore, women form 61% of that group, and men the remaining 39%. Literacy rates of older males is 96%, and of older females, 79%. Turning to financial security, women are at a disadvantage. The Silver Support Scheme is the basic tax finance social pension scheme that supports the bottom 1/3 of Singaporeans aged 65 and above. Understandably, 65% of the recipients are women. The payouts are low. And finally, although women live longer than men on average, just as Anissa said, they have more illness and disability, osteoporosis, osteoarthritis, and dementia. Now, after a few years of experimenting, we finally have the creation of an effective agency of integrated care. This is now the single agency which coordinates the delivery of aged care across both health and social domains. 80% of the resident population in Singapore live in high-rise flats or apartments built by the government. One scheme worth mentioning is the installation of highly subsidized slip-resistant floor tiles, grab bars, and ramps for the flats, which house people over 60. This helps to prevent falls which lead to fractures. Other noteworthy programs are 2 health screening programs for residents aged 60 and above. One is a simple functional screening to ensure that the eyes, ears, and mouth are in good health. And where needed, the seniors will be provided with assistive devices such as spectacles, hearing aids, and dentures at affordable cost. The other screening program is based on age and gender. Any female over the age of 25 can have cervical cancer screening, and those over 50 can have screening for breast cancer, colorectal cancer, and for chronic diseases. Recommendations are also made for influenza and pneumococcal vaccine, and older citizens are provided this at a subsidized rate. Of course, Singapore is very fortunate it can do that because it is a developed country. I will just end up with one more remark. One good initiative that I would like to mention, which is not by the government and which has been alluded to by Dr. Tata, is the setting up of an NGO called WINGS more than a decade ago. This is the Women's Initiative for Aging Successfully. It's the only organization in Singapore that is solely for older women. It has 3 areas of focus: attention to active aging, financial security, and social engagement. There are many other active aging centers in Singapore, but they cater for both men and women. Thank you.
Thank you very much, Kani, for outlining the good practice of Singapore and also highlighting some of the key health challenges that older women could face. And we will come back to you during the second round to talk about how we can protect them from isolation, abuse, and ageism, which is an area of very strong focus for you. Our last question to the last panelist during this round is, but not the least definitely, is Professor Dato Dr. Tengku Aizan Hamid, who is a professor in gerontology and social policy in Malaysia, was pioneered the development of gerontological research and education in Malaysia And you're also the first director of the Multidisciplinary Research Institute on Aging. So Dr. Hamid, you have throughout your work highlighted the importance of social protection and universal healthcare. You also support the concept of healthy aging. So how is that being implemented in Malaysia? So if we can do that in our 3 to 4 minutes available, over to you, Dr. Hamid.
Thank you, Srinivas. And I would like to share some of the practices that we do in Malaysia, because if you look at we look at social protection, we usually look at only on the financial part of it. But today I would like to share with you the health protection activities that Malaysia has adopted for population health. And I'm sure you are all aware that Malaysia has 2-tier health systems. And then we have the public health and also the private health system. And if you look at Malaysia's health system in terms of public services, we are basically near universal, because the population or the citizens of Malaysia only pays about 1 ringgit registration and also 5 ringgit registration for specialist services in the public public hospitals and health centers. And also, if you look at our primary health services in Malaysia, we really go down towards the real well-spread services all over Malaysia. And because of that, we have increased our life expectancy and also increased our population health. And if you look at the services for older person in terms of health, they basically have free health prescription drugs and also health services. And also, if you look at our situation in terms of elderly health and healthy aging, we have 3 different major ethnic groups that are having different health status in that sense. And if you look at we need to look at the cultural practices also in terms of providing or providing health for the older person. And if you look at the practices that has been done in Malaysia, the government actually spend less than 5% of GDP in the health services. And there are also areas of concern that the government are addressing right now. For example, previously we are very focused on curative, but right now we need to focus on preventive, promotive, and rehabilitative medicine, as healthy aging is a lifelong process. So in the sense that the social investment across the lifespan, especially in terms of health, is very critical. And at the same time, we need to have health literacy, advocacy, because a lot of Malaysians right now do not really spend so much time on their health, because if you look at the social determinants of health, it far outweighs the physical determinant across the lifespan. So we need to really provide this education in the population so that they are responsible for their own health. And hopefully the government is now very much into trying to do health reforms for the population in light of the aging population. And they are now working on a white paper to transform the healthcare system to meet future needs and demand. And they plan to get it tabled in Parliament in November. But another aspect that I would like to share with you all is in the terms of getting data, because we are fortunate in the sense that we under the Ministry of Education, we have the long-term research grant system that we have been working on the mental health aspects of older population. So we have already, since 2013, we have been working on mild cognitive impairment. And in the second round of the grant, we are now working on the intervention aspect of it, because in Malaysia, we lack the coordinated or a continuous stream of long-term care
Data.
services. So we need data for that, and we are fortunate that a group of us in the universities has a consortium of us working on this, so that we provide the
Thank you.
data
Yeah.
for planning. So it is very critical in this matter, because mental health is a very major issue, and because it has cultural dimension to it, and we need to really respond to this quite fast, because we are aging very, very fast, and we are not ready in the terms of streamlining what is needed and things like that. So I think I'll stop here, because
Thank you so much. I think you've raised several important issues. One is the fact that the non-financial side of social protection, I mean, one that's going to be done. You highlighted the need for universal healthcare to be supplemented by health promotion and health literacy. It's not just about providing curative healthcare.
Right.
And above all, the need to strengthen mental health services, apart from the other long-term care services, where areas are not ready.
Yeah.
So we've come to the end of our first round, and I think we've taken a little more time because we wanted to lay the ground for the discussion. So if I can request panelists to be a little more focused and maybe take about 2 minutes, maybe in the second round, to address certain focus questions, because a lot of participants want to ask you questions also. So it will be great if we can be more forward. We have laid it beautifully in the first round. So my second question, the second round, my first question to you, Dr. JP, is what under your leadership, what are you doing to increase participation of older women in society in general, in terms of through your policies? So over to you, Dr. JP, if you can give us a succinct response to that.
Yes, thank you, Srinivas. Over the last decade, the Philippines has come up with several policies to institutionalize long-term care. And for older persons, and of course it will affect women more than men, but the most recent among the policies that we have come up with is the creation of a national commission for senior citizens in 2019, but COVID sort of took over the political scenery, and it has been delayed in coming into action. So we have a lot of national programs working on long-term care, voluntary programs, even encouraging older persons to volunteer, residential care, home care, and institutional care. But the challenge today is more demographically, is that we started to have our demographic transition with lower fertility in 2020. And apparently by 2030 or 2035, our society will begin to age. So we have a very short window for a demographic dividend, which is 10 to 15 years, and it's even less now. So our government is very focused on how it can take advantage of this demographic dividend. But at the same time, we need to work on the policies for long-term care, for better policies and activities for the older persons, which has been shown to be, rather than decreasing in morbidity, we are seeing increased morbidity among older persons. And that will have an effect on the healthcare system. And we are also decentralizing even more our resources. So the burden of a service will shift over the next 3 years from national government to local governments. And that will be an interesting, situation, as we have been heavily affected by COVID, but now we also have to start developing work for, developing programs for older persons, which will include community-based rehabilitation, local long-term care at the local level. So much will be done at the, at the fringes of governance, no? And we hope that not those living in geographically isolated, disadvantaged areas will be at greatest risk of being left behind. So those are the policy areas that we need to work on.
I think you really kind of pointed out, I mean, the fact that you're decentralizing, involving communities more, but that may lead, you have to understand it may work very well in certain areas, may not work well in certain areas, depending on the capacity. I think it's a very interesting point, and in a way was related, in a way addressed by, raised by Dr. Geeta Sen in her response, and it's a very interesting linkage that you bring up. Dr. Sen, let me come to you with a very, seeking a very succinct answer to this question. That it's a very, I know I'm asking a very simplistic answer to a very complicated question. What are the policies that you think, if you can think of 2 or 3 policies or 5 policies that can be identified to reduce inequalities that older women face so that they can contribute more fully to society? Sorry for a very simplistic question, but you are the best person to answer it.
Thank you, Srinivas. So let me start out by saying, in response to your last question, women are always contributing more than their fair share to society.
Yes.
It is society that doesn't recognize or give back sufficiently to women. I'm sure you agree with me. Women are resilient and tend to come back if and when opportunities come up, but their resilience shouldn't become a way to add to their burdens. So the problems faced by older women are, as I said, the result of cumulated gender insults over a lifetime. And they cannot really be resolved in old age alone, but the following are some examples of the kinds of things that I think you're asking for. First, economic insecurity is a huge problem for older women. And I think ensuring an old age pension for each older woman, which is under her control as much as possible, is critically important. Secondly, there should be regular health care days for older women in different situations, whether they are in the health facilities or in the community. And this could be similar to the special days for pregnant women, for instance, to receive antenatal care, which you already find in many contexts. So these could provide preventive and promotive services. Community workers will need special training to do this effectively. And I think different speakers like Kani and others have spoken about the ways this can be done. Primary care, strengthening primary care for older women. Third, intergenerational programs that bring older women and young people together. It's good for mental health and solidarity building, and can in fact help to reduce violence and the threat of violence as young people build relationships with older persons and older women in particular. And it's a mutually beneficial. In fact, in India right now, there's a private sector attempt, or rather the Tata Trusts have started a way by which youngsters can in fact come and spend time, and they get a small stipend for doing this with an older person, read to them, talk to them, etc. But there's a reverse learning as well that can happen with that. And lastly, digital literacy classes for older women. Very, very important, I believe, in today's digital age. And quite often, older women are the ones who neither have access to the instruments, and even if they have access to the instruments, they don't quite know how to use them or what to do with them. And I think that's something that could be very helpful.
Thank you so much, Dr. Sen. You kind of really did not disappoint. You really were so categorical in your responses. Very helpful, and allows me to move on to Ms. Anisa Ahmed. Anisa, again, drawing on experience from Maldives, what can we do to support older women to remain active members of society? Maybe a very succinct answer from you, Ms. Ahmed.
Thank you, Dr. Srinivasan. I have just, I was in point form, I'll say. First of all, elderly women must be given autonomy that they have a right to. like Dr. Geeta Sen said, digital inclusion of older women and men must be ensured by training them. So digital literacy is very important. The state also has to establish, to provide long-term palliative healthcare without being subjected to these elderly women being subject to neglect, abuse, or violence. Programs have to be programs to make elderly women economically productive and be active agents in their communities must be a priority for strengthening or for protecting the rights of elderly people. I also would like to point out some of the good practices that we have. Like again, Dr. Geeta said, we have a program. The state carries this out, and I also have to say our current gender minister is very strong on this. Intergenerational interactions, like multi-generational, where the young and the elderly have they sit together, they discuss issues. So both sides actually benefit by that. So that's a very successful program the government is carrying on. Then again, this old age pension, which is universal, also is something that is very beneficial for the elderly people. And again, another practice is that public transport is free for the elderly, both men and women. And we have a universal coverage of health service. And also we have another good practice. Older people do not have to stay in queues for public service.
Right.
So, these are a few points I've noted, and I wanted to share them. But I have a very big grievance because none of the elderly, whether it's men or women, have the opportunity to contribute to national development plans or policies. This is a grievance I have, so I thought I'd just share it with you. Thank you.
Thank you, Ms. Ahmed. It's very interesting. I mean, you've highlighted a number of good practices, but also I think having organizations of older persons, maybe ensuring that the voices of older persons feed into development programs. It's very essential. We are interesting. We have a summit of the future being discussed, and interesting that maybe people are looking only at the youth without realizing the future is also about older persons, and with an increasing number of older persons. Thank you very much, Ms. Ahmed. Dr. Soin, my question to you is, what can society do to increase the resilience of older women and protect them from isolation, abuse, and ageism, which is an area which we have kind of briefly touched upon, but over to you for your response.
Here, I want to concentrate on the very important subject of ageism. WHO defines ageism as stereotyping, prejudice, and discrimination directed towards people on the basis of their age. Negative stereotyping in old age is common, but its gender dimension is a double blow for women. Women become older earlier and are more often judged by their physical appearance and not by their accomplishments. What I want to stress is that combating ageism is not just a social issue, but affects the physical and cognitive health and well-being of older adults in measurable ways and can take years of one's life. First, the positive news. A study of over 2 decades by Dr. Becca Levy found that the median survival was 7.5 years longer for those with the most positive beliefs about aging compared with those having the most negative attitudes. Older people exposed to implicit positive age stereotypes scored better on tests of gait, balance, and strength than control groups did. Now the bad news. We know through well-researched studies that beyond reduced longevity, ageism is also associated with bad outcomes for people who hold negative feelings and stereotypes about old age. These people had higher rates of heart attacks and strokes when followed up for 40 years. They also exhibited brain changes associated with Alzheimer's disease. This study suggests that combating negative beliefs about aging could potentially offer a way to reduce the rapidly rising rate of Alzheimer's disease, which causes dementia in millions of people worldwide. Dementia is more common in women and is a brutal disease. Now, this is groundbreaking news because it's the first study to link the brain changes related to Alzheimer's disease to a culturally based psychosocial risk factor, namely ageism. And ageism can be moderated. So what we need to do now is that we need to eradicate ageism against older people and ensure that older people do not internalize these beliefs themselves. And this should be considered as a public health imperative. We should be redoubling our efforts to do this as the payoff is so high compared to other types of health measures for supporting older people. And lastly, we should be working on all older women to let them know that their resilience is extraordinary and their contributions should be acknowledged and celebrated. If women can internalize these positive beliefs, then we can reap the positive physical, mental, and well-being payoffs. Thank you for giving me the time to talk about something which is I'm very passionate about.
Your passion shone through, Kani, and I'm sure people would like to come back and ask, but you highlighted the very important issue of how ageism can affect the health and maybe affect older persons in more ways than we can imagine. So I really think this is a great message that you put out. And the last question in this round is to Dr. Tengku Hamid. Dr. Tengku, how we know that COVID-19 devastated the lives of older persons, but we also know that older persons and older women became the backbone of supporting societies during this time. So what have we learned about the resilience of older women in crisis situations based on our COVID-19 experience? Just for a succinct answer from you before we go back to questions.
I think the situation of older women in Malaysia during COVID-19 is dependent on the characteristics of the older person themselves, because I see the older women are key family caregivers. And in the pandemic, that affected the significant, especially when there are death occurs in the family. Because and also during COVID-19, there are what you call movement control policies that affected the involvement of older women in this process, and also in the sense that they also were being they couldn't go out to get income and things like that, because in the sense that because of the movement they cannot do that. And one of the things that happened in Malaysia during COVID is that we use My Sejahtera mobile based application that created some technological barriers to access and usage for the older person. But what happened is that when these the primary providers of the care of the household died and things like that, they are the one who are really the caregivers of the older person in the family, and also the children, because they have to adjust to the situation. And because of that, some people in the urban areas are okay because they have the support system for that. But if you look at the older women in the rural areas, they are at a disadvantage in the sense that they are at the same time maybe exposed to the COVID situation, because they are the frontliners of people in society, taking care of the person themselves, and also they are the workers in the institutions. So they are double jeopardy in terms of that. So, but they managed to do that. And to me, it is also important that we, the policymakers and the stakeholders, must think about looking at the design of things, because there are situations where the standard of overall what you call the plastic covering of the frontline workers are always based on the size of the men. So they might not be be protected so well because it doesn't fit them and things like that. But these are very particular, but they manage. And a lot of the time, older women in Malaysia during COVID are the one who provides they become volunteers to provide for foods and things like that to the community where they live. So to me, they can adjust very well because women are used to multitasking. So when situations like that comes in, they can mobilize themselves and get colleagues to help each other, and also bang on the doors of the policymakers so that you must act, something like that. So in the sense that the older women are really knocking on the friends' doors and the policymakers' door to get this thing done, because they know how effective, how it will affect them in the end if they don't do that. So yes. I thank you, and I need to leave.
Okay. Thank you for making those points. It would have been great to have you respond to any questions, but I'm sure the other panelists can cover it. Yes. So thank you very much, Dr. Hamid, and thank you for being part of this panel. Now, that very nicely kind of sets us up for a short period of, we have a little time left for Q&A. We already have, I would like maybe people in the audience to put up their hands, and we can maybe unmute them just to ask a short question. Please ensure that they are not long comments, but questions to our panelists. We already have one question in the chat from Michael Bleasdale, and I'm going to go for his second question first. And I'm going to ask any one of our panelists, and they have all talked about the importance of digital accessibility. His point is very well taken, that technology and other advances are often not designed to accommodate older persons. And this, I can take the liberty of mentioning persons with disability also. For example, my aged care internet portal in Australia was awarded for public service, but required a multi-million-dollar program to help older people navigate it. What would your comment be on this? That how can we, is this accessibility a major issue within websites and within, within the portals which have been created to access government services, especially? Maybe any one of our, maybe a hand up from any one of our panelists if they would want to answer this question from your experience. Anissa, maybe to you first.
Well, internet connection to all islands, as most of you would know, the geography of the country is, it's widespread, we have small islands, but I think access to the internet in almost all the islands is there. And most of our elderly people also have the gadgets that they need, the telephones, the smartphones, most of them have, but they're not able to use it. They only can make calls, but besides that, they don't know anything. So I think that digital literacy, educating them or training them to make use of those smartphones is what we need to do. I think it's not going to cost much, I believe, so for me, it's not a huge problem. Okay.
Dr. Sen, is it more, is the solution simple or is it slightly more complex than that?
I think there's some parts of it that are simple and some that may be more complex. And now I'm talking, from personal experience of living with a 94-year-old mother who has arthritis, as a result of which it's very difficult for her. And remember, this is an upper middle class woman with all the facilities and resources to use a phone which is not enabled for an older person. Seeing, touching, using. So there's some things which are about the hardware of technology, but definitely also the software in terms of digital literacy. They could very easily be supportive classes that could help. And this isn't just a middle class problem, because these days, women in the marketplace selling all have little phones which they're using. The smartphone has become so much cheaper in terms of its uses. And those women could be able to make much better use of the phones, but we need much more by way of digital literacy for, particularly for women.
Thank you so much, Geeta. Would any one of our other panelists want to intervene at this point? Otherwise, I would like to also maybe reach out to someone who was my supervisor here, Thelma. I would like you to your perspectives on some of the issues that were laid out, and if you have any questions for our panelists here.
Okay, thank you for giving me the floor, Srinivas. That was a stellar panel. I'm just wondering that we are now having a lot of work done on the new convention for the Convention for Older Persons. What do you think would be the impact of such a convention? Do you think some of our countries need to change their laws to combat ageism this way? For example, I'm from Singapore, and I had a lot of trouble after I reached a certain age, after I retired, getting a credit card, being recognized as somebody who was still productive and who was still, I felt so isolated, like I was cut off from society. I didn't exist anymore. So how do you think this can be remedied? Maybe our panel members can shed some light on this.
Wonderful question. I mean, let me come back to the panel. We've been having discussions for years about whether we should have, and there was an open-ended working group entirely on whether a convention is required or what would it look like and whether it would be useful. I would really like to go back to the panel, maybe I'm going to put Dr. JP on the spot, but maybe any of the panel members to reflect on it. What do you think would be, why is there a utility? What are your thoughts on the utility of such a convention if it comes into force?
Yes, I was talking to our ambassador in the UN in New York back in April, and he's now become our foreign minister in the country. And he was talking to me about the need for a convention for older persons. And he brought it up in one of the UN meetings in New York, and he wanted to push for that. So there is, something to be said for a convention that would be affecting, for example, 20% of the population by 2050. I mean, we need to think of these conventions ahead of a period of time when, for example, by 2050 in the Philippines, older persons will outnumber the 0 to 4-year-old group by 3 to 1. And the social and health and economic impact of a large segment of the population living unhealthy lives in poverty and in social deprivation really needs global action. Just the numbers, just think of the numbers, and their quality of life would require a convention. So there is some, at least our foreign minister would be open to that, I believe.
Yes, the discussions are ongoing for some time. There are challenges that they identify, the protagonists, and in terms of, yes, the feasibility, because the actions lie in many sectors, social protection, health. But I think very clearly, if there is a will, there has to be a way. Anybody else? Dr. Geeta, Kani, or Anisa, put up your hand, and maybe I'll go to Kani and Geeta next. Yes, Anisa, brief comment from you, please.
Thank you. Well, definitely it's going to be useful, convention and international convention on the elderly. But I would like to also, take a negative connotation on that, because our constitution itself says that the elderly and disadvantaged persons are entitled to protection and special assistance, family, community, and the state. Despite this, from this year onwards, elderly people, people from 65 and above age, is not entitled to a digital passport. Until now, we've been holding digital passports for no reason the government decided not to give elderly people a digital passport. So even the constitution provides for this, I mean, the rights are not protected well. I don't know, if it's going to be, if it's going to make a difference, having an international convention.
You're I mean, the point that made by you is, if the national constitution specified this question of implementation rather than having a list of legislation. Kani, I would like to come to you. We have a couple of hands up. Eva, of course, I wanted to come to you at the end to get your thoughts. We have a question from Gemma Rodriguez, but Kani, and do you have any quick thoughts on this, Kani and Geeta, on the convention, quickly? I think they've gone offline temporarily. So let me go to Gemma Rodriguez. Do you have Rodriguez? Gemma Rodriguez, can you give her the floor, please?
Srinivas, I can
yes,
comment
sorry, Gemma,
on
hold Yes, Geeta,
please. On the convention. And I think, Kani, you were muted, but I think a convention would be great. But one of the things, just from my experience, that I know is that the quality of such conventions depends very much on also the presence and inputs from civil society, from the people who are working on the ground. So I think it's really, really important, if people are pushing for a convention, that there be civil society mobilization that would identify the realities and experiences on the ground and make sure that those get integrated into the convention.
Thank you. That's great. Kani, if you can unmute yourself and answer the question, please.
I have a problem, Srinivas. There is some renovation going on and it's going to disturb your...
We can hear you clearly now. We can hear you, no problem.
Well, I think I'm completely of the mind that Geeta is on, that we don't want to have a convention just for the sake of having a convention, if it's going to make a difference. And this is why we do need a ground up effort to see what is needed and whether it's going to make an effort, and not just pat ourselves, oh yeah, we've got another convention. So I think it has to be an effective convention. That's what I'm sorry about this noise.
No,
but
no, not a problem. We all face this, don't worry.
So I'll keep quiet now and let someone else speak.
No, we really love hearing you speak. Eva, please, your thoughts, please, before I go to Gemma Rodriguez, please. Eva. Please go ahead.
We have discussed it for many years. I mean, we here in Indonesia and with the ministries, and we do believe, and our Ministry of Foreign Affairs has also mentioned it at the UN in New York. We do believe in the Convention on the Rights of Older Persons. Why? Because we and most countries need a legally binding document for the rights of older persons. In our country, we have enough policies and programs, but the implementation is still not as we hoped it would be. So if there is a Convention on the Rights of Older Persons and ratified by our government, the related ministries are legally bounded by the
Yes. Yes, Eva, very good point. Yeah.
Okay.
Yeah. Thank you. I mean, you know that discussions have been going on for 10 years in New York. The Open Working Group has been discussing it. Everyone says, yeah, it would be good, but we don't have any progress being made. Obviously, we need to kickstart the process again. Maybe we can facilitate it. We can talk about what are the key issues. But however, I have Gemma Rodriguez with a hand up. Do you have a question for our panelists? Would you please unmute yourself? Can you please give her the floor? Yes, Gemma.
Hi. Good afternoon or good morning, everyone. That was a really insightful talk. I have about 3 points that I'd like to talk, but at first I would like to comment on in relation to the Convention on the Rights of the Older Persons. I wanted to know, I mean, if there is going to be one, what would that look like? Because states are very notorious in implementation and internalization of international law. For example, we have the 1966 International Covenant on Economic, Social, and Cultural Rights that talks about of everyone the right to social security. And I think this is what we are here now, is that we looked at older people, where I'm going to be soon. And I also realized that because I have done all those parts that what we discussed about today, the unpaid care. And I realized I don't have enough social security because, most of my lives were providing care for free. And now that I'm working, I realized that in 15 years' time, when I'm about to retire, I don't have enough. And so there's so many rights within the International Covenant that when we looked at individually within domestic laws, and then when states create their domestic law in relation, for example, to social security, I think it was mentioned in the video that there is a blind spot. Yes, there is a blind spot because some of the states, when they internalize international law on social security, it's mainly for the workers. And so when you're not working and, obviously you are disadvantaged. And the next that I would like to talk about is the cultural practice. Women are always being the person who are to provide care. I mean, there's only two types of sex in this planet. There is male and female. But it is always the female has to give up for the other part. And yes, also the International Labour Convention 102, there's also a blind spot on that. And also when states implement that, it's always funded or it's privately, and Asian welfare state system is, I think Jones said that it's all economic, and it's, it's the family that provides care, provide health care, and that has to change. That's all. Thank you.
Thank you very much for sharing your thoughts. I'd like to go back to the panelists for final thoughts, roundup of anything that you think was important, just a few takeaway messages, because we've really reached the end of our time. And I know that you as panelists also have other appointments. So just a quick word from you. Can I start with Dr. JP? Just, 30-second, 1 minute wrap up from you.
Yes.
About key messages you want to leave with us.
Yes. On this topic, I think what we were all hoping for with universal healthcare, with improvement of the health systems, was that morbidity would be going down for older persons and that the quality of life would be improved. But apparently that's not happening, and countries are not doing enough for older persons. And we must do more to decrease the morbidity of older persons and improve their quality of life. A convention would help set the tone, but of course it will need working parties, civil society. I agree with Geeta. We can not have another convention that will be left half-hearted, implemented in a half-hearted way. And governments are notorious for losing focus. But a convention would help us focus on this impending issue and at least be a focal point for civil society to engage government. Thank you.
I think that's a great point. I think coming from a senior government official in Philippines, very encouraging for us to hear. Geeta, over to you for your 1 minute wrap up.
I would say one additional thing that the build up towards a convention might actually help to do, which is to change. We really need some way of changing the public attitude towards age. so that the ageism that Kani spoke about can really be addressed and dealt with. And the convention, the build-up for a convention might actually provide the opportunity for educating the public about what aging means, what ageism is, what older people face, what the nature of inequality and challenges is. So I think it can, I mean, Srinivas, you said this convention's been sitting around for 10 years going nowhere. But if maybe it's time for building it up, building up a momentum towards it, but public awareness of its importance would, I think, be really, really valuable. And that, along with the role of civil society, academic researchers, and so on, and of course, governments will be at the center of it, would be critical.
Yes. Thank you, Geeta. Kani, over to you, then we'll go to Anisa. Kani, 1 minute.
Well, what we cannot talk about the situation of older women if we don't talk about gender equality. We don't have gender equality in any country in the world. So it's obvious if you don't have gender equality for younger women, then the situation is not going to be easy for older women. So I think when we want to deal with the issues, and I think Geeta addressed that, when we want to deal with issues to do with older women, we have to go back to gender equality. That's one point. The second point that is making me a bit worried is that there are so many technologies and medications that are now reversing and slowing aging. And this will only be able to be afforded by rich countries, rich individuals, a lot of money. And this is going to make the inequality and the differences between getting old healthily and productively to getting old in a very sad manner. And how we are going to overcome this is another big issue we have to think about.
Thank you very much, Kani. Over to you, Anisa, for your final thoughts on this.
Thank you, Dr. Srinivas. Well, I think what we have to keep in mind, or even make aware, public aware, and also the states, governments aware, is that we're not only talking about the benefits for older people, but respect for older people's rights benefits society as a whole. And protecting their rights will allow societies to better capitalize on the potential of these older people. So I think that's, I think that is exactly why we are also going to have an international convention on the rights of the elderly. And if the governments have the will to implement that, I'm sure it's going to benefit all of us. Thank you.
Thank you very much to all our panelists. And I think it is, I just would like to take the liberty of just taking 1 more minute. Ms. Sabdono, do you have any last final thoughts for us? Would you, or can we proceed towards the closing?
Well, we are really for a convention on the rights of older persons, including the rights of older women, because there is still a lot to do. Like we mentioned, if we talk about gender, the discrimination, etc., etc. So we hope that with a convention on the rights of older persons, more of these issues can be overcome.
Thank you so much. Thank you very much. And we've come to the end of this really, really rich panel discussions. And we are very fortunate to have had such distinguished panelists who spared time and speakers who provided us great insights into the lives and contributions of older persons. The interest level is very clear from me. I've been watching the participants, it has not dropped at all. Despite the long event, people have been here, I think, quite spellbound by what our speakers have had to offer. I think you've given us some food for thought in terms of what ESCAP can do in order to stimulate this discussion and kickstart it from the region in terms of how a convention can be shaped and what it can look like Gemma said. Okay, I thank you for your recommendations, especially on how we can address issues related to older women. Kind of syncs very well with the outcome document of the regional review. Rest assured, older women and older persons remain high on the agenda of ESCAP, far beyond just this day of older persons. We'll continue to work with member states, but above all with civil societies and organizations of older persons and older persons themselves in order to further this agenda. We are identifying several synergies. From the 19th to the 21st of October 2022 in Jakarta, co-hosted by the government of Indonesia. Madam Iwa, you'd be very interested to know, we are holding the final review of the Asian Pacific Decade of Persons with Disabilities. For the first time in the outcome document, we have really integrated the fact that a large number of these persons with disability will be older persons. And I think there's a huge synergy between both these agendas, and we need to do more in addressing this. We also have the 7th Asia Pacific Population Conference, which will be held later next year. And there's a big opportunity in highlighting these and talking about this whole issue of demographic change and the change in the structure of societies. And that is where we will be coming back to all of you in the planning of this. We've been talking to UNFPA, and because there is the whole ICPD agenda, to tell you very frankly, is still very unclear about what's going to happen at the global level, but that should not hold us back from doing our own regional Asia Pacific Population Conference. And a lot of you who contributed to the last one would be very interested in knowing, in engaging with us in moving ahead with this planning. I assure you that population aging will feature, I'm sure, very prominently in these discussions. And I thank you very much. And I would like to ask for a virtual clap for our panelists and all our speakers. And thank you very much for joining us. Stay healthy and have a great weekend and the rest of the year. Thank you so much.